Welcome to Lanier's Healthy Living Show, another edition of the program where we get to give you tips and educate you on different ways for you to stay healthy and happy. Remembering or bearing in mind that a healthy man is not just a wealthy man, but also a happy man. Welcome to the program. Today on the program, we're going to be delving into something that is usually not often talked about until it is too late, but we are hoping to change the narrative, and that is prostate health, early detection and prevention of prostate cancer. You know that prostate cancer is one of the cancers that affects men, and most people have certain misconceptions about prostate cancer. So people will tell you that some lifestyle changes like eating tomatoes and engaging in frequent sexual activity might reduce the risk of having prostate cancer. Is this true? And is prostate something that affects old men? Well, our doctor in the house is here today to educate us, and of course, if these things we think about is not true, he's also here to shed more light on prostate health and of course prostate cancer. Join me as I welcome Dr. Onyekachi Ono, a urologist at Nnamdi Azikiwe University Teaching Hospital. Doc, welcome to Lanier's Healthy Living Show.
Thank you, Priska. Good to be on the show this evening. Thank you.
Okay, it's a pleasure to have you. You know, just before we even started, somebody walked into the studio and was saying, is prostate something that affects young men? And I was telling him that he's the reason why we are doing this program today. And so we would like to start from there before we delve into what is actually prostate, based on what he said before we started the show. You know, people tend to have this misconception that prostate cancer or prostate-related ailments is something that is peculiar to older men. Is this true? What age bracket is a risk of, contracting one form of prostate disease or the other?
Okay, thank you for that. Actually, the prostate suffers generally from three different kinds of diseases. One can have prostate cancer, one can have prostate enlargement, one can have prostate infection, what we call prostatitis. Now, actually, this spectrum of disease can affect the prostate. There is no particular group of people. Once someone has prostate organ, he is at risk of having any of these diseases. Okay. Now, the important thing is that some people are more at risk of having cancer, okay, than other people. Those who are elderly are more at risk. Now, that doesn't completely rule out those who are young. Okay, prostate enlargement also tends to occur more middle-aged people and then elderly people. That doesn't completely also rule out that it can occur in young people, okay? But it's just about the risk, which tends to increase with age, yeah.
Okay.
I think that's what I was saying.
All right, so let's start with understanding the prostate and what risk it poses. All right, so what is prostate and what role does it actually play in men's health? Prostate as an organ, what is it and what role does it play in men's health?
Thank you about that. Now the prostate is an organ in the body. It's actually an male ancestry organ of reproduction. So females don't have prostate, so it's a male thing. Okay? Now, the prostate is just like a small organ. People describe it as a walnut. It's walnut shaped. Okay? Very small, weighs about 20 to 30 grams. That sits just underneath the bladder, okay? At the neck of the bladder from where urine outflows from the bladder. It sits around, it hugs it, okay? And then what does it play? What role does it play? It actually contributes in reproduction. It contributes around 30% of the secretion that you have in your semen, okay? So that's like essentially what it does, okay? But it's also sad to say that this small organ actually in the body is one of the most common causes of disease in males. Thank you.
Oh, the prostate, you mean?
Yeah.
Okay. Now, do you think this issue of prostate health is something that is often talked about in this part of the world? Is it a conversation people usually have? Or do you think people tend to shy away to discuss anything that has to do with the prostate because they have this belief that it's old man's disease?
Yes, but even apart from being people seeing it as old man's disease, anything that has to do with a sexual organ or sex, in this part of the world, people don't get too free to discuss it. Okay, unlike what is the case in the Western world. So there is generally this reluctance to discuss anything that may be related to sex and one's sexual life and one's life generally. So I think that's more of the problem really when it comes to discussing that. So actually people don't get to talk about it much, and that's part of the reason why we are having more like what looks like an epidemic, particularly of something like prostate cancer now. Okay, and little by little people are now getting a little bit more interested now in talking about of recent. Okay, and but also the social media is also helping us with that.
Okay, so you mentioned there are elements with regards to the prostate. You spoke about prostate enlargement, prostate infection, and prostate cancer.
Exactly.
Which of this is more dangerous? And the one that is dangerous, are there early signs and symptoms of either of these prostate ailments? Or which of them is more,
Okay. Now, prostate infection, not too common, really.
Is that too common?
Not too common.
Oh.
Not too common. It can be a sexually transmitted infection.
Oh.
Can also occur when there is maybe difficulty in passing out urine. Urine refluxes into the prostate, causes infection. But it's not as common as prostate enlargement and prostate cancer. Now, talking about the one that is more deadly, of course, cancer is the most deadly, okay, of the three of them. Okay, yes, prostate cancer is more deadly than the three of them. Now, you're saying the signs that one may have that may suggest prostate cancer. Generally speaking, early cancer in the prostate usually doesn't cause any symptom.
Oh, really?
Yes.
Wow.
And that's actually the place where screening comes in to be able to detect the cancer when it's still not causing any problem. The man goes about, he feels good, but there is a cancer growing in the prostate. Okay? So early cancer usually does not give any symptom. The man may even be urinating well. But once the cancer starts advancing, it may begin to manifest in signs of difficulty in passing urine. The man may, when he goes to wee, he will be straining to pass out to wee, and it may take a long time to wee. Now, it's also important to know that those are also the same signs that prostate enlargement will also give you. Okay? So both of them share those urinary symptoms. One may also go to wee and then pass out blood in the urine. Okay, those are common for them. Now, but aside from these, now the prostate cancer may now, one of the things that marks it, particularly when it becomes advanced, is that it can spread to the body and then starts giving more complications. It normally goes to the bone, and the patient will start having severe low back pain. It can enter the spinal cord and cause paralysis. The person will not be able to walk again. It can spread to the chest and cause breathlessness, which actually all those are signs of terminal, like one is coming to the terminal stage of life.
Okay, at what age should men start screening for, against prostate cancer or the likes? Or at what age should they start screening for, to spot maybe
now,
they have it?
I think that's a very important question. Generally, there is no consensus age
for men to start
for
screening
one
for
to
prostate?
start screening for cancer. Now, there are many urological bodies worldwide, those in Europe, those in Asia. People come out with their own guideline of what we do in our place, what we do in Europe, what we do in Asia, what we do in America. There is some variation among them, but generally it ranges between 40 to 50 years. Okay? Now, the reason is because as I said before, early prostate cancer is asymptomatic. Now, most people that may have asymptomatic disease may be able to pick it early when they are younger. But prostate cancer tends to occur more in elderly people. But if one can start early to screen, to check, he may be able to detect it early and then receive appropriate care that will cure the disease.
Okay.
So between 40 to 50. But it's also important to know that we in the black race, we have a little more risk of having prostate cancer than those abroad. So if those in Asia is putting their own as 50 because they are white, those in America, we that are blacks who have more risk of having prostate cancer, I think our own should be lower.
Okay.
So for me, if you ask me, I will say something around 45. If a man gets up to 45, you should start doing something
Or
about
is
it.
there a reason why black people are at higher risk of having prostate cancer? Is there any scientific reason that has
Well,
been, discovered
there is no documented reason
as to why black
why
people
that is
are
so.
high risk?
Though there are, people have made some propositions, but there is no documented. Just also like something like sickle cell disease.
Okay.
We know it's also more like a West African problem. It's not common when you also go abroad. Okay, so something around that. It's just been discovered that those who are of the black race, even those who are in America, black Americans, they tend to have more of prostate cancer than the whites. They tend to have the aggressive type of prostate cancer, and they tend to die more from prostate cancer than the whites. Now, these are established facts in science.
Okay. All right. So I want to ask something. This situation where it comes to a certain point where a man uses a pipe to relieve himself, does it have something to do with prostates? Where a man can pass urine normally, you have to use the aid of a pipe.
Yeah, exactly. Now, that is one of the most common, urinary difficulty is one of the most common symptoms of prostate disease. And as I said, it can occur with prostate enlargement, it can occur with prostate cancer. They may come to a point where they will not be able to urinate freely. They will need a pipe. Because if they don't do that, that's training to pass urine, the pressure gets to the kidneys, and then the kidneys can pack up.
And because the prostate is located near the bladder?
Yeah, it's just at the neck of the bladder, sitting there. And with age, it tends to change in conformation and size, and then it's compressing on that neck of that bladder. So, difficulty for urine to pass.
Okay.
So that's essentially what happens. So we use it more like to bypass that obstruction so that urine can flow out, the kidneys can feel better.
Okay, so beyond the fact that black people are prone to, having some form of prostate disease or the other, are there lifestyle factors or like family history or genetic factors that can predispose one to contracting prostate cancer?
Yes, Briska, of course, there are. Okay, let me talk about family history first. Now, there is a positive family history is actually one of the risk factors for developing prostate cancer.
If it's in your family, there are chances that.
Yeah, it means that your chances are high. Now, that does not mean, because we are also here to address misconceptions, that does not mean that if it is not in your family that you cannot have it.
Okay.
Because I meet some people in the clinic who come and say, no, it's not in our family, it's not in our blood.
Yes.
And they feel that confers on them an absolute protection from that. Are you getting me now? So if there is a positive family history of prostate cancer in the family, it increases the relative risk of any male in that family. Are you getting me? Now, assuming that my father had prostate cancer, it was diagnosed at 70 years, and your dad, you are a male, your dad does not have, nobody in your family has it. I have a 4-fold increased risk of having prostate cancer
in your family,
relative to you, who does not have it. Now, that does not mean you cannot have it, but I have more risk. If my father was diagnosed first at 60, that risk increases from 4-fold to 5. If that diagnosis was made at 50 years, or if I had a family history of someone in my family that developed at 50 years, it also increases my risk to 7-fold. And not just about family history of prostate cancer. Also, if I have a positive history of family history of ovarian cancer or breast cancer in the family, okay, that also has some genetic link, okay, to prostate cancer disease, because one of the genes that causes breast cancer is also implicated in the formation of prostate cancer. Are you getting me? Mm-hmm. So family history is an important risk factor, and usually those that have a strong family history, they tend to develop prostate cancer earlier in life. Like currently now, we have a patient on the ward who is 50 years, he has advanced prostate cancer. I've managed a patient who was 43 years, he had also aggressive prostate cancer. Usually those ones that tend to occur very early in people who are middle-aged, younger age, most of them there is a strong family history of prostate cancer in that family.
That is why they had it at that age.
At that age. And it tends to run an aggressive course. Okay. Now, apart from family history, you're also talking about lifestyle changes.
The lifestyle factors, like the things people do that can predispose them.
Yes. Now, let's take for instance, the only one that has been proved by science, particularly, is smoking.
Smoking?
Yes. Oh. Almost all the cancers in the body, almost all of them, smoking hurts them. Now, for prostate cancer, smoking has not been found to increase the chance of having it. However, now people that smoke have been found to develop the more aggressive type of prostate cancer. And they also have been noted that they tend to die more from prostate cancer than those who don't smoke. Now, that is for lifestyle. Then coming to nutrition, diet, there's been a lot of conflicting information, even on the social media and everywhere. Some people believe that if you take vegetables, you take fruits, you take tomatoes, many of those things, that it gives you, it confers protection, just like you said, immunity against developing prostate cancer. Now, those actually are not proved consensus scientific facts. Now, you know, in science, we don't base things on hearsay. Okay, if you say that this thing, this fruit or this green tea, for example, that it confers protection, okay, we don't just accept it because somebody just comes out from somewhere and just say, well, this confers protection. We subject it to a test. We subject it to research. Some people take green tea, some people don't take. We follow them up, and we now see what number of these people will develop prostate cancer, what number of these people will develop prostate cancer, and what types. Okay, now, and we don't just base policies or this kind of guidelines based on one study. We normally will do what we call a meta-analysis or systemic review. Now, that involves pulling researches that have been done from different parts of the world, quality researches, combining them together and see what agreements are they having. Now, many of these research has been done on all these things, and none of them really have been shown to have any conclusive evidence that it reduces the risk of prostate cancer. Green tea, there's a little evidence that it may reduce the aggressive type of prostate cancer, not that it reduces the risk generally. Are you getting me? So that is what we have in the body of literature. But of course, we don't also stop people taking this. I tell people, take fruits and vegetables, it's good for life, okay? But not as if it's conferring to you any particular remarkable protection from developing prostate cancer. Okay, because part of the problem our people have is that once you tell them that this thing is, they won't understand the whole thing. Once they start taking tomatoes or start taking whatever, they will now abandon the medical aspect of doing their prostate checks and all that. And then suddenly they will come down with prostate cancer. Okay, so that's what I have to say.
All right, so you know when we started, we said beyond educating people about prostate health and also making people to pay more attention, especially men, go for screening to find out on time if their prostate is in order. We also said that there were a lot of myths and controversies about it, and that you're going to tell us if this is based on fact or if it's just conjecture like people do online. And one of them is that frequent sexual activity, engaging in frequent sexual activity reduces your risk of developing prostate cancer. And also masturbation reduces your risk of getting prostate cancer. So is this fact or fiction?
I want to think it's more fiction than fact, actually. Okay, now
so there is no evidence-based
let me be more
research.
scientific.
Okay,
now there are some studies that people have quoted where they agree with what you said, that frequent ejaculation, frequent sexual activity reduces the risk of one contracting prostate cancer or developing prostate cancer. Now, there are also a lot of studies that are also contrary to that. Okay. Now, so there is no consensus agreement from systemic reviews or meta-analysis that proves that frequent ejaculation, frequent sexual activity actually confers protection from one developing prostate cancer. Okay, at most they are more of conflicting and controversial than actually being factual. Okay, now let me tell you this. We managed a patient, okay, in the hospital. This man was a big lawyer in this state. We were managing him. We were doing castration for. He has actually developed advanced prostate cancer.
So by castration, removing his testicles?
Yes. Now that's one of the things we do for advanced prostate cancer. So we were getting this done, and this man was lamenting on the operating table. You know what he was saying? You know what he said? He said, that doc, that they used to tell them that when they gather, with their learned colleagues. I'm mentioning lawyer because to show the level of, education and exposure that they have. Now, he told us that when they meet in their club, in their group, that what they normally discuss is this thing you said, that frequent ejaculation. Yeah. So they encourage themselves to get what they call side chicks so that you will just keep having sex, ejaculating. And here he is, he's saying, wow, so with all these things that he still has developed this. And now we are going to give a treatment that is going to knock off that aspect of his life.
So no more sex with him?
No more sex. Of course, the drive and everything is going to be low once you remove the testes. That's what controls your sexual urge and even erection and all those.
Oh, okay. So is that like the, how do I put it? Is that like the highest treatment, or is that the last treatment for somebody whose cancer has gotten to that aggressive stage?
Yes, that is, there are many treatment options, but that is at the center of those who have developed a cancer, prostate cancer, that has spread to the body, to different parts of the body. When you have prostate cancer that has spread to different parts of the body, you can't actually cure those patients, okay? Because the cancer has spread. If it's cancer that is still localized, still at the prostate, and that's why screening comes in. You detect it early. When it's still confined to the prostate, you can go and do some local treatment. You can do what we call radical surgery, remove that whole prostate with the cancer inside. It hasn't spread anywhere. So you can say that you've cured the person of cancer. You can do what we call radiotherapy or brachytherapy or radiotherapy, put some focal radiation to that place, kill off the cancer. And when it has spread to the body, your hands are tied. You can't do that, okay? So the much we do at that stage is to say, okay, what fits the prostate? Because we said it's an accessory, it's an organ of reproduction. At the center of reproduction is the testis. So it's the testis that produces the male hormone that stimulates the prostate to grow, and as well stimulates the cancer cells to grow. As I get what I'm saying. So when you cut off the testis, either by removing it surgically or giving some drugs that will make it not to function, you are knocking off that testosterone that comes from there.
That can fuel the cancer.
Yeah, so you are more like starving the cancer of food.
Of food for it
so the cancer will begin to shrink. So at the center of the different things we do for cancer that spread to the body, prostate cancer that spread to the body, is this thing we call androgen deprivation therapy, to cut off androgen, that's the male hormone, from the prostate, so that the cancer can shrink, and wherever it has spread to the body, it can begin to,
but is prostate cancer what we'll call a death sentence?
Sorry, I didn't get it.
Is it a death sentence that's having prostate cancer?
No, because that's another myth that some people have.
Yeah.
Okay, if people, once you say cancer, they feel that their life has ended. And actually, we have to do a lot of counseling to say, no, this is not a death sentence. Even those who have what we call advanced cancer, we also tell them it's not a death sentence, but we may also counsel them that inevitably, okay, they may succumb to it. Where the cancer has already spread to the body, you are seeing the patient may be down, very weak, no blood, maybe even be paralyzed because it has gone to the spine. You are seeing the end, maybe in the next 5 years, in the next 2 years, the man may be gone. So we do counsel them. We do what we call end-of-life care, counsel them. make sure they stay out of pain, and counsel them, get the family to also know where we are going to. They can also be part of the care. Now, but early prostate cancer, or what we call locally advanced prostate cancer, cancer that has not spread to the body, that's still within the prostate or just around the prostate, one can get a cure. Okay, one can get a cure. I've seen a patient that had prostate cancer. He had surgery in the US in around 1978. He had a radical prostatectomy. The prostate was removed. I saw him at the hospital last December. So you can imagine he has lived for getting to around 30 years. And he was still fit and about. He had 1 or 2 little complaints, but he was okay. So it's not essentially, the key to it is at what stage are you meeting the patient? Is it when it's still confined to the prostate, or is it when it has spread across the body?
So which is why it's very important that every man should go for screening once in a while.
Exactly.
To find out on time before it gets too late.
Yeah.
All right, so what about this myth about the fact that having a vasectomy can actually predispose one to contracting prostate cancer? Is it true?
Predisposing or protecting. I think that what people think that if you get a vasectomy, it can protect you.
Yeah, protect you. Yeah, protect you.
Now, vasectomy is more like a surgical way of male contraception.
Yeah.
Okay, where you tie up the dots that carry the sperm so that the man cannot impregnate a woman. So it's more like a contraception. Now, that does not confer any protection to one developing prostate cancer. You know, just like I told you, in what causes prostate cancer is you have the testes, the hormones that come from the testes, and then the prostate environment. So when you do vasectomy, you are just tying the dots that is carrying the semen. The testosterone, the male hormone, is secreted in the blood and is carried in the blood around the body, also to the prostate. Are you getting me? Now, you have not interrupted that pathway. Actually, what confers some protection is if you remove a man's testes, those that are eunuchs. Are you getting me? Who maybe because of their special work, usually in the olden days when kings have married a lot of wives, they keep eunuchs who take care of their wives. So they castrate them so that they don't get to have access to their wives sexually. So those group of people, particularly when it's done early, usually before puberty, you can almost say that there is no risk of developing prostate cancer, but it's still not absolute. Now the reason is because the testis only produces 95% of the male hormone. There's still a small component that comes from what we call adrenal glands. Okay, there's still some component that comes from the fat in the body. Okay, where it is converted, where estrogen in the fat is converted to the male hormone. So that you even castrate somebody does not completely knock off all the testosterone in the body. And we said at the center of this is the testosterone, the male hormone, and then the milieu, the environment of the prostate. That's actually what is involved in the cancer development.
So in other words, you're saying that even when someone is castrated, that doesn't exactly eliminate them from contracting prostate cancer?
Yes, but to a very, very, very great extent. Like eunuchs, okay, they rarely would develop prostate cancer. Okay. Eunuchs. Okay. And it's because of castration.
Okay.
Yeah.
Okay. All right. This is still Nonye's Healthy Living Chair, and we are talking about prostate health, early detection, and the prevention of prostate cancer, and also some of the myths and controversies that have surrounded prostate health in recent times, and what people ought to know. Particularly, people saying that it's old man disease. Well, you've been listening to Dr. Onyekachi Ono today with us here, a urologist, debunking some of these myths and controversies, and of course, providing scientific proof with regards to different issues surrounding the prostate and, of course, prostate cancer as well. Okay, we're moving on. Okay, now what I want to ask is, some people have said that, there is some kind of unwritten cultural stigma that some men have, like an ego thing, more like that they feel emasculated going to the hospital for digital rectal exams, that kind of thing, so that they would rather not go because to them it's like a form of emasculation. Should this be something that people should be looking at?
Well, let me say, one of the ways we screen for prostate cancer, there's a PSA test we do, But apart from that, is what you call a digital rectal examination.
That's what people are saying.
And that involves a man lying down, of course, undressing, lying down, and the doctor, the urologist, gets to
That's the thing.
wear a glove on the hand, then stick his finger into the man's hand,
well.
and then feel the prostate. Now, it looks. How will I put it? It looks embarrassing.
That's what I'm telling you. That's what I'm saying. That's the reason why I don't go.
Okay,
Yes.
for us to do that, but there's no other way. Unfortunately, there's no other substitute
So that is the only way.
to assess the prostate, because how it feels, are you getting me? How it feels can suggest that there is likelihood of cancer in the prostate. A prostate that is not cancerous generally tends to be soft, you know, is not soft really, it's a firm gland, smooth, you feel it very smooth, okay? But when it begins to be ragged, when it begins to have nodules here and there are some peculiar ways a urologist will put at the hand and feel the prostate and say, no, there's some suspicion of cancer here. It may not be absolute, are you getting me? But it will now be like a note of warning to say, go and investigate this patient further for you to make that diagnosis, if at all the cancer is there.
And so you're saying that without this one, you're saying the rectal examination, there is no other way to dictate it.
I'm not saying that there is no other way. I've talked about a PSA test that we do. Okay, that's more like the common one we do. A blood test that collects your blood sample and then assess for the level of PSA in your blood. Okay, now if it's high, it also suggests. Okay, but we've discovered that if you do the blood test and then do your rectal exam and combine what you get from the two of them, that gives you a higher likelihood, a higher what we call prediction value of getting the cancer or not getting it than using any of them in isolation. So beyond doing a PSA, we also want to feel and to check how the prostate feels.
Okay. All right. So there is another saying with regards to supplements, supplements and herbal alternatives that they can actually, reduce the risk of someone contracting prostate cancer, taking herbal supplements and herbal alternative medicine, taking them regularly, that it can protect you from, contracting it in the near future.
Now that is not scientific. Are you getting me? There are some herbal supplements that have been purported that they may help patients who have prostate enlargement. It may help them to urinate better. But in the literature, even that one in the literature hasn't been confirmed. Just like I talked about meta-analysis, systemic reviews, even for those that have prostate enlargement, it hasn't been confirmed. So we don't use it.
Okay.
But when you come to prostate cancer, there are no herbal supplements as at today that actually forms one of the, either for prevention or for treatment, forms the arm of either the prevention or treatment of prostate cancer. It was in December also, we saw a patient in the clinic. This man was taking, and you know what? Because people don't want orthodox medicine somehow. Those of us in Africa, we still think more towards the native, towards the, are you getting me? Now, many people feel more attuned to that. And the pharmaceutical companies, they're actually cashing out. You go to the market, there are a lot of herbal drugs on prostate. They know that prostate disease is a common disease. So they're pushing in a lot of herbal drugs, and people are buying them and thinking that it will do them good. I met a patient who was taking that. He came to see me. He actually saw a doctor, and the doctor told him, no, this is your prostate, no surgery. You don't need any surgery. Just be taking these herbal drugs. You're going to be fine. Give him some drugs to be taking. The man had taken it for like 5-6 years. At the point he came and he was meeting me, he was having signs of advanced prostate cancer. One leg has swollen up, the scrotum has swollen up from lymphatic obstruction. He was having low back pain at the back. These are things that, and once you put your hand to feel the prostate, you just bring out your hand. The place is looking very cancerous. And I felt bad for the man. I said, unfortunately, he met a doctor, because that's also part of our problem. The doctor didn't refer him to a urologist. The doctor was managing with herbal drugs, told the man there's no problem. And I told him no. That if I have met you, I told him I'm going to do a biopsy for you. Biopsy is what we use to confirm that a patient has prostate cancer or not.
Yeah.
I told him I'm going to do biopsy. And I told him if I had been the one that met you 5 years ago, I would have done a biopsy for you. And maybe that's the time would have caught the cancer early
before
to do something
became
curative.
worse.
But you know what happened? Even after telling this man that he need biopsy, I didn't see him again. So obviously, there's another myth. Part of the myth actually is that people feel, they say that if you do any surgery on the prostate, the person will die.
Yeah, a lot of people.
I don't know whether you've heard that.
Yeah.
They say if you do any surgery on the prostate patient, so immediately I told him we are going to need to do a small surgery where we use special needles to pick up some tissue from your prostate to send for histological assessment. The man ran away. We didn't get to see him again. And of course, you can predict what would have happened to him by now, if at all. I don't know.
He's still here.
So that's also part of the problem we have. Okay? People say once you do surgery in the prostate, the man will die. That nobody recovers from prostate surgery. That's what they say in town. But I tell them, no, it depends on where you go. It depends on if you are meeting the right person. Another thing they also say is that if you do biopsy, that it will now make the cancer to spread.
Biopsy just to detect if you actually have cancer.
Exactly. But there's a myth in town, and that's actually a common knowledge among people in town. They said once you put needle there, it will now spread. I said no. Like for him, it has already spread. We only need to confirm it before we can start treatment. And the man disappeared. So we are still trying to educate our people. We are still trying to do what we can to pass across the right information, because even the Bible said people perish because of lack of knowledge. And that's why we are trying to do all this. For people to get educated, have the right information from the right people. You can imagine if you ask the people if you ask them who is telling them these things, then when you do biopsy that cancer will spread, or when you do surgery on the person will die, it will be somebody in their yard or someone in their marketplace. That person may not have crossed the four walls of a medical school, and he's telling you something and you're believing it and holding on it more strongly than what a specialist in that field who has been trained for 12 years, what he will tell you. You can imagine the absurdity, but that's what we find in our environment. We continue to do the education.
Okay, so what I want to find out is there a correlation between your bladder health and prostate cancer? Because I think I met a man once, I think he came for an event, and all of a sudden he now, eased himself, like he urinated on himself.
Yeah.
And he was so ashamed to stand up from there. So people were just, going around trying to see if they could get something to clean him up and all that.
Very
so he just
embarrassing.
sat down there. Yeah. And people were not saying that he just had a prostate surgery or something like that. So I'm wondering, does this prostate issues, does it affect the bladder in any way?
Obviously, the prostate and the bladder, they are more like brothers and sisters, so to speak.
Okay.
The bladder pushes out urine. Okay. The prostate is around the neck. It can obstruct urine flow. And when the prostate does that, the bladder keeps trying to make attempt to force urine,
just come out.
And it begins to change. Even the function of the bladder begins to change. Okay? And then they begin to have a range of urinary symptoms, which what you mentioned is actually part of the complex. It's a symptom complex that occurs in those who have a difficulty in passing out urine. Of course, prostate is at the center of any challenge in passing out urine. Prostate is the most common cause, okay? And so there is a lot of symptom complex that leads to that. So it's not the prostate surgery that is causing that, it's the prostate itself that is obstructing the flow of urine, that is now causing the bladder to have what we call in quote bladder dysfunction or bladder failure, that it now gives rise to a range of urinary symptoms.
But wasn't the surgery supposed to correct that?
I wouldn't know the man in question. I wouldn't know what surgery was done. Maybe the man had prostate biopsy. Prostate biopsy is a test, is an investigation, is not a curative thing. Maybe the man had, assuming the man had prostate biopsy, that's saying he had prostate surgery.
The man later died.
Prostate biopsy is not a treatment. It's just an investigation to get your prostate to go and have sex in the lab. I get it. So it depends on what he did. It depends on what surgery the man had. Yes.
Okay. So does obesity increase the risk of one contracting prostate cancer?
Obesity, it does not confer any protection. Okay, this is scientific. Now, but the only thing that's been found out for obesity is that it's those that are obese and they have prostate cancer. It has been found out that they tend to have the aggressive type of prostate cancer. So, not being obese does not confer. In fact, let me tell you the truth. I can't remember seeing any man who is overtly obese and he has prostate cancer, really. So the common prostate cancer patient will not even be obese. I've not seen a reasonable number of obese patients coming. Most of the patients I know, of course, maybe they were obese before, but once the cancer sets in, weight loss, of course, many of them will come at an advanced age in our environment, so one may not be able to say. So I've not seen much, but it doesn't confer any protection. But those that are obese have been found to have more of the aggressive type.
Okay, so does consuming dairy products like milk and cheese and, you know, the dairy products or red meats, does it lower the risk of contracting prostate cancer for men? Because I know you get to a certain stage, they say, stop eating red meat, eat white meat, do this, do that.
Well, that may play some role in some other conditions in the body, but not prostate disease, not prostate cancer.
Okay.
Just like I told you, all
So
these things are what people are just pushing out to the media to get followership, what people are just proposing without any well-structured meta-analysis or systemic review to prove and confirm that yes, that studies have done over around the world, all of them are in tandem that red meat will increase prostate cancer. So it is not a documented risk factor or something that reduces the risk. Okay, consuming red meat or white meat or what have you. Okay, it doesn't. Now, just all of what I told you, generally, those are consuming vegetables, fruits, nuts, all those vegetarian diets. Okay. Now, the genesis of this actually is that it was found out that those who are more in all those Asia, Japanese, who eat more of these, that they tend to have less risk, less prostate cancer among them than those of us. And they now discover that when they migrate to the US, their diet changes, their incidence of their risk of developing prostate cancer now begins to match that of the normal US population. So it now made us to think that, well, it could be from their food, what they eat. But then research has also been done, and it has been found that that is not actually what confers protection to them. Maybe something genetic that makes it, but it doesn't have to do with the maternal diet.
Okay, what about regular workouts, exercising? Does it help in any way?
All these things are generally good for health.
Not prostate particularly.
Not particularly as it is conferring any particular protection, immunity against prostate cancer.
Okay,
yes.
So this taboo of men being embarrassed with regards to going for digital rectal exams to determine if they have the risk factor of contracting prostate cancer in the near future. Do you think there is a way for us to change the narrative?
Okay, now, for now, all over the world, if you meet a urologist,
that is the only way.
You have difficulty in passing urine, we have to stick our hand in there. It's almost like a rule. You have to do that. Okay? Now, apart from that, we are now also doing ultrasound, what we call transrectal ultrasound. But it's also the same thing, where you are getting the ultrasound probe, putting inside the anus of a patient, and then you are seeing the prostate on the ultrasound screen. So which one is better? Is it the ultrasound? We do all of them anyway. We do all of them together. But even the ultrasound is also equivalent to your putting your hand. It's still almost, even the ultrasound probe is bigger than my finger. So
maybe they'll feel comfortable with machine and not a human being.
Mm-hmm. Well, maybe.
Okay.
But you can't remove that aspect of clinical examination.
So you're saying people should just chest it and just go and do
it's not a big deal. Just it's a little embarrassing.
It's not a big deal because you're the urologist. You don't see it as a big deal. You're not the patient. Because
Oh my
I guess,
God.
I guarantee if you are the patient, you will not be shouting it's not a big deal.
Well,
You're the doctor, so of course it's not a big deal. You're not the one doing the exam.
maybe I want to agree with you on that.
Well, okay, all right. So let's talk treatment and survival. So, if detected early, what are the treatment options for prostate cancer?
Okay, now prostate cancer, early prostate cancer, as I said, you have the prostate cancer, it's still confined to the prostate, or it has spread just locally around the prostate. Such kind of patients, they can get cure of their prostate disease. When I say cure, it's also not in completely absolute sense, because there's something we call recurrence. Are you getting me?
Like you can come back?
Yes. Yeah, there's something we call recurrence. But so it's still in a relative term, okay? That's compared to those who have an advanced disease. If you come early, you get treatment. After 10 years, almost like 95% of them will still be alive.
Okay, so but you're saying that there is a chance for it to come back?
Yes, there's something we call recurrence. Now, so when you have early prostate cancer or localized prostate cancer, there are treatment options. And the aim of the treatment option is for you to get a cure. Now, but there are many things we also factor in now determining what each patient needs. Okay, it's not as if every patient goes through the same routine. Now, there are options. Number one option is surgery. This cancer is inside the prostate. There is no evidence that it has gone out of the body. Now, that's where what I said comes into play. That evidence is not absolute. We have imaging modalities that can show to a reasonable extent that it hasn't spread up around the body, but they are not 100% sensitive. Some of them are 90%, some of them are 95%, which means they can still miss out a spread. Are you getting me? Whether a local spread or a distant spread. Now, so surgery, this cancer is localized in the prostate. Now you come and then you do surgery and then you remove the prostate in one hole, take it out. Now when you do that, the prostate is gone, the cancer is gone with it. And then you repair the place. Of course, you now need to join the pipe that takes urine out to the bladder. So there's no prostate again. Now that is an option.
So that pipe will be there forever?
No, I'm saying the
Okay.
tube in the body that runs
body.
in the penis that brings out urine and semen.
Okay.
You now join it to the bladder. You remove the prostate that normally stays in between, now goes off. You now join it straight to the bladder.
Okay.
Okay? Now, that's an option. There are other details to that, but I'm not going to go into that.
Okay.
Now, another option is to do what we call radiotherapy. Now, in radiotherapy, you are getting radioactive elements, okay? You are putting you are using a focused radiotherapy to kill the cancer cells. Now, it can be done in two ways, generally. The patient can lie on the couch. You now use your radiotherapy machine, focus rays in that part of the body that will kill the cancer. Okay? That's an option. There's also what we call brachytherapy. Brachytherapy, you get the radioactive seeds. You do a kind of small percutaneous surgery. You put the seeds inside the prostate. And then it will now emit rays to the nearby prostate with the cancer, and then they will kill off the cancer. We call that brachytherapy. So now these are options that can be done that can, as I said, reasonably cure the patients of prostate cancer.
Okay. All right.
Now, apart from these also, there are some patients that may come, they may be too frail. They have prostate cancer, but they are too frail to go through all this. Or maybe because of what they're suffering, their life expectancy is not even too long. And because all these other modalities of treatment, they also have their own complications. So you now need to balance. This man is 80 years old, he has prostate cancer that is localized. Do I pursue treating it? What do I gain? How much years does he have to live? And I say, okay, I'm not going to treat, but I'm going to monitor this man. If he shows any sign of worsening symptom, I'll manage the symptom. I'll leave the man alone. Or if the person is young, you may also say, okay, let me monitor this man. If this cancer, I've seen that he has cancer, but it's a low-grade cancer. If the cancer progresses to become a higher grade, that shows sign that he's likely becoming aggressive, I will go in and treat. So there are actually a whole lot of what we do, okay, based on the patient characteristics and then the tumor characteristics as well.
Okay, so how does prostate cancer affect a man's sexual health and well-being?
All right.
Because you know that's what most people are worried about, especially when they contract it.
Exactly. Now, I'm going to go through a lot of things. Number one, prostate enlargement or prostate cancer can affect, or even prostate infection, all of them can affect erection.
Oh.
Yes. Infection of the prostate. And the reason is because the nerves that control erection actually run behind the prostate. So any disease on the prostate has the capacity to affect those nerves that control erection. So any disease in the prostate cancer can infiltrate those nerves and they will not function. The man may not get an erection. Enlargement can compress on them, and then they will also not, the erection will not be optimal. Now, apart from these, of course, patients who also have prostate cancer, they have a little meat that also affects their sexual life.
Okay.
Somehow they feel that when they have sex, that they are going to transmit the cancer to their partner. Some of them will come and say, okay, can I still go ahead and have sex with my wife? So they feel psychologically that if they have sex, they are going to, because this thing is something that runs in the semen, that they are going to transmit it.
Yeah.
So you also will need to clear that, okay? Now, apart from that, cancer in itself, particularly those that have advanced cancer, okay, at the point where they may be coming, because the cancer has already affected their whole body, they may not even be able to have, not that they may not want to, but they may not be strong enough to even have sex. Now, let me also say that part of some of the treatment that are given for prostate cancer may also affect erection. Yeah, because I said the nerves that control erection runs just behind the prostate. Even when we do surgery to take off the whole prostate, okay, in those that have cancer, there's a little risk that it may affect those erectile nerves, and then after the surgery, they may have some challenge with erection. A good number of them will recover, but some few may not. So everything about the prostate, yes, has something to do with sexual life.
Okay, so all right, before we go, what message do you have to men with regards to getting tested for prostate cancer and other prostate-related ailments?
Now, what I have to say, you have a disease, you have any problem that you think is related to your prostate, go and find a urologist out there and then talk it out with the doctor, okay? And if you are up to 45 years, 45 years, please, it's better early than late. Go and do your prostate screening. I normally counsel patients if it's once a year, okay? So I say target to your birthday, maybe the day after your birthday. Use it to remind yourself that you need to go for tests. Use it to do general tests, do your PSA, do your digital rectal examination, or any other health check you want to do. Let it be an annual thing so that you can monitor your health, so that in case there is anything that is trying to come up, can be detected early, and then appropriate treatment can be given.
Okay. Well, you've heard from the urologist that came for the program today. Most of all these controversies and myths are basically what it is. But if you're having difficulty understanding anything that has to do with your body, and in this case, your prostate, it's always advisable that you go to a qualified medical practitioner that will help you and give you the answers you seek. And what you've heard, it's not just anything that has to do with old man disease. So, you know, if you get to the age of 40, 45, it's advisable that you go for prostate screening. Remember, prevention is always better than cure.
I agree with you.
It's early, it's important you detect it early, while still at the, you know, minute stage
Early
before
stage.
it gets advanced and you start having issues. Please, let's just get our information from the right source.
Exactly.
Remember, it's all about a healthy living and a happy living. We want to thank Dr. Onyekachi Ono. He's a urologist at Nnamdi Azikiwe University Teaching Hospital in Nnewi. Thank you for taking the time.
It's my pleasure,
to educate
Priska.
our people today.
Thank you.
Okay, well, like I said, it's not a death sentence. Just do the right thing. If you have questions, contact your healthcare provider, live a healthier life, and live a happy life. Well, this is where we draw the curtain today on Nonye's Healthy Living Show. And next week, we'll be back here with a very interesting and, of course, educative episode for you. I am Priska Wankwo. We'll see you next week.